My name is Yoon. I am from the International Vaccine Institute, and I was asked to talk about equitable access. And so this is titled Equitable Access to Medical Countermeasures, but it's, in fact, it's not really focused on dengue. It's more focused in general on equitable access. And since I'm from IVI, maybe a little focused on vaccines, just to warn you ahead of time. So IVI is a UN-chartered organization dedicated to vaccines, international organization. And the mission is to discover, develop, and deliver safe, effective, and affordable vaccines. And importantly, empowering vaccine equity, impact, and sustainability globally. So IVI works across the globe. We have a headquarters and labs in Seoul, Korea. A couple of years ago, IVI set up a European regional office in Stockholm. Last year, an Africa regional office in Rwanda, in Kigali. And then recently set up country offices in Austria and soon to be in Kenya. 50 sites in 30 plus countries, so a global footprint. And so before I rejoined IVI, I was at CEPI. And so I'm going to start with some lessons learned from the COVID-19 pandemic. And it always kind of strikes me, especially lately, how much we do or want to forget about the pandemic as we move further away from it. And I know people have already heard lessons before, but I just want to remind you of those. So I'll give 5 lessons, not exhaustive, but 5. So the first lesson is that crisis accelerates innovation, and things that were thought not possible, crisis seems to be able to make them possible. But a few caveats to this is that the innovations that were accelerated during the crisis really had started before. So it wasn't that they were totally new innovations, it was that they were accelerated during this crisis. The other is that when we talk about innovations, we're not just talking about technology innovations, we're also talking about systems innovations or regulatory innovations or other policy innovations. So innovations is really a broad term to allow anything to happen. And then the third thing that I think a caveat to this is that even though innovations were accelerated, this was COVID specific. And so COVID as a target for all of these innovations may be easier or harder than other targets that might happen in the future. So if there's an expectation that all of a sudden the same things that were done during COVID can be done for some future epidemic or pandemic or future disease, that's not necessarily the case. And in fact, most vaccines that were developed actually worked against COVID. I'm not sure that you could say that for a lot of diseases. The second lesson is that funding is required to do this. There was lots of funding that was applied to accelerate these innovations. You can't just do it on the cheap, although there's expectations sometimes during inter-pandemic periods, expectations that this somehow can happen. But Operation Warp Speed was up to $18 billion that was invested. CEPI, more international, $1.5 billion. These are large amounts compared to some of the amounts that are being invested currently. The third lesson is that when we want to, when there's a crisis or need, we can scale to billions of, in this case, vaccine doses, and that's pretty remarkable. So it's possible with funding or with incentive. However, equitable access to those billions of doses is much harder. And this graph is an illustration with all the companies that developed the vaccines. 8 billion doses were produced. But proportionally, those were pre-purchased by high-income countries, proportionally much greater than they needed or that was really equitable. And there was a bad taste after the pandemic. These inequities eroded public trust, and that led to certain other implications that I think we're still dealing with. And then the fifth lesson that I will mention is that impact is about delivery. Ultimately, you want impact, and the impact is about delivery. Katie mentioned on day one that, this oft-stated phrase that vaccines do not save lives, vaccinations do, in the case of vaccines. But it really is about impact and delivery, which is about delivery. And so this global map indicates the percentage of the populations of these countries that received at least one shot of COVID vaccine by January 2022. And you can see the clear color heterogeneity that indicates the inequity of the distribution. So these are 5 lessons that I wanted to highlight from the COVID-19 pandemic that I think we're starting to forget quite a bit. And I mentioned access and delivery, which means impact globally, but there's all these steps before then, and one thing that I would mention is that acceptance does not equal impact. Acceptance does not equal, in other words, access and delivery. And there's lots of examples of tools that show this, and this is just the example of rotavirus vaccines, which went through a long development period, and a couple of rotavirus vaccines that were licensed in the US in 2006, WHO made recommendations in 2009. A WHO estimate of huge burden, 450,000 deaths in under 5-year-olds per year, which varies, which then started this multi-year period of adoption or introduction in a lot of these countries, so that from an initial approval until 75 countries introduced the vaccine, with in between Gavi actually funding it for lower income countries. It's a 10-year period between the first acceptance until 75 countries introduced the vaccine. So it was a long period after the presumed success of an endpoint of development. And this shows the actual uptake, and rotavirus, there's a bunch of different vaccines here on this graph, but rotavirus is the lowest one. And that's a 15-year period with still far away from the actual target. And in this case, the target was the WHO Global Vaccine Action Plan, a 10-year period up to 2020, and not even close, even though there was this development success. And this is actually accentuated in middle-income countries, which falls in between in some ways, the Gavi-eligible countries and the wealthy countries, which can afford them or are subsidized. So where does the middle-income countries, how does that work in terms of delivery and impact? And this is in particular, I think, the case with dengue vaccines. I think people understand that dengue is a huge problem in Gavi-eligible countries, but in particular in middle-income countries. So with these lessons and with these examples, when we're talking about vaccine R&D, and I'm talking about vaccines because I'm from the International Vaccine Institute, but also other interventions or other strategies should start with the end in mind, or for this summit, the end game in mind. And the start is really the need. So we need, in this case, safe, effective rotavirus vaccine, or whatever other tool that we need. But we should think about the impact. What are we trying to do? What is the intent of whatever we're doing with the need, and trying to come up with whatever solutions there are? And so by doing that, and this is a truism, right? Just in life, we should think with the goal in mind, but it's very easy to not think about that or lose track of that when we're talking about all of these different things because of the complexity of those. So if we talk about then the need and then the impact, then we're somewhat forced to talk about everything in between and at least think about it. Some of them may need to start earlier and funded earlier. Some of them may need to start later and it's more difficult. But all of these things need to be thought about. And so from, let's say, this vaccine standpoint, the supply, there's going to be all of this vaccine R&D activity, the science, but also probably early on, there needs to be thought about how does this get produced? Is it the right technology to be produced for access, global access? What developing country vaccine manufacturers might be interested? What kind of market is there? Or planning for technology transfer? So there's a huge supply side part of this, and then there's the demand side of it, and people are looking into it, and there's studies that are ongoing, continuous, the burden data, cost effectiveness, et cetera, support for some of these entities like NRAs and NITAGs. So a lot of activities that then ultimately inform the demand side, which is groups like WHO or PAHO and the individual NITAGs, the financing, et cetera. But all of this has to happen or thought about in parallel in order to get to the delivery stage, which then requires its own thought process. So all of this it relies on what the expected impact is. And one of the issues that I see, in particular with dengue, is that as you're developing this, you might start off with the desire to have this optimal tool that, let's say, has tetravalent protection for a vaccine. But you end up with a tool that is a useful, but not a perfect tool, that will change what the impact expectation is. And then you might have other tools that are not vaccines, or, for example, vector control or Wolbachia type tools, that then have all of their issues. What is the expected impact? How does that all work together? And that impact may need to change, and that's really important because it drives how you pursue everything in between and also how you communicate the expectation of people that are eventually going to need to implement these. So thinking about all of this is critical, but can get lost as you're trying to look into the details of each of these sub-bullet points, which each bullet point and sub-bullet point are incredibly complicated in and of themselves. So with the end in mind, this I'll go through really quickly. You know, the WHO has its role, PAHO has its role, policy, pooled procurement, advanced market commitments, which didn't work so well during COVID. But again, these are some of the things that people are actively struggling with. National governments, you know, how are they going to fund domestic efforts or policies? How are they going to communicate that to the communities? Industry, you know, they have a lot of things to juggle. Clearly, a commercial market, some reputational issues. How are they going to deal with access in light of all of those other things? Tiered pricing, that's something I'm sure that they've been struggling with, especially as they come to are thinking more and more about market, but even during the development phase, as I said, all of this stuff needs to be thought about early. And then I put this foundations and nonprofits. What is the role? And an important role, of course, is fill some of the gaps, but a coordination function is a huge role. I know WHO has a role, but how can they be supported also? And so there's a lot of things that need to be done in parallel, and you can't rely on just looking like, I'll bring up the elephant again, just looking at one part of the elephant, or as somebody else said, just one elephant. So this is critical in order to do anything really implementable and deliverable and therefore impactful. And I will just mention that post-COVID vaccine, there was a lot of thinking based on the inequities about how the distribution of the production is done. And so there was a lot of and still is a lot of thought about regional and national vaccine manufacturing for vaccine security and what that means and how is that even done or sustainable. On the flip side, at the same time, with the same goal of global equitable access, there's perhaps the desire to make things as cheap as possible, so have one or two global manufacturers that can drive the prices down as much as possible. So in some ways, the solution for this global manufacturing or production access hasn't really been resolved yet. And then the people resources, how is all of this done? Because people like infrastructure, but that really doesn't do the job. It requires some level of sustainability with people that have appropriate expertise. And I would say this, because a lot of folks are involved with R&D, that I think one of the areas that is suffering right now in the global climate of maybe withdrawing finances in some cases, that a global equitable R&D development is really at risk. And R&D development is, in fact, in particular, a long-term initiative, a long-term requirement. And then this is my final slide, but I will end by saying that as we're talking about this, as we're talking about our individual lanes within dengue, and then as we're talking about dengue as a field, and then as we're talking about vaccines as a field, and then as we're talking about global health as a field, clearly those cannot be considered in isolation. And in fact, maybe the things that affect what we consider really important in the dengue field or in vaccines or global health, the most important, impactful, I shouldn't say impactful, the most important things that will affect the progress is in fact outside of the field. So I think we have to consider that, at least consider it. Maybe we can't resolve it, but at least consider it. And we talk about some of these like climate change and what the impact of that will be and how complicated that will be. But there's lots of things. And I hear a lot of questions about vaccine hesitancy, for example, and uptake and how to communicate that. And a lot of the responses are, well, we need to communicate truthfully or clearly about the scientific pros and cons. And I think about then how to communicate all of the crazy information and things that are happening outside of this field, but that gain traction. And so what is driving that? How is social media and the algorithm driving what we're able to do in terms of vaccine hesitancy? And so I think that we still have to keep in mind that the whole picture, we may be kind of riding this current, and we have to know how we can affect change and what is affecting us, and then try to optimize where we fit into that whole picture. So with that, I thank you for your attention.